so much, Dr. Brown. Thank you, Dr. Narbonne, for your valuable insights. And I think we are all having a great time learning so much from different physicians here about inequities. And I think one thing we can all kind of decide that yes, we are all in this room because we believe that there are existing inequities in healthcare in terms of rural Wisconsin. And so what I'm going to do in the brief period of time I have is to kind of show my way of addressing and approaching these health inequities. And I want to do it with an example, talking about a community project that I recently led in 2022 and 2023. So the first thing when I decided to have a project was I wanted to align it with what the community needs. As a physician leader, I really wanted to know, what does the community expect from me? I did not want to have a random project that I liked and I was passionate about, but I wanted to do something that, yes, I was passionate about, but it also would be helpful for the community. So the first thing that I did was I went on the community county webpage, and so as you can see, I belong from the Portage County, which is the heart of Wisconsin. And this is our community health page, and I clicked on the Community Health Improvement Plan, which is abbreviated as CHIP, and so every county has its own CHIP and has it for a certain number of years. And what I noticed was, and I did browse through all of these particular links, and what I noticed was a lot of work was being done in terms of mental health and alcohol and other drug abuse, but not much was being done about healthy weight. There was still some work being done, but the needle had not moved at all in the past 20 years. And that's where I found my next project. I was passionate about it. Being a pediatric endocrinologist in my practice, I care for children who struggle with weight management, and I really wanted to make it my own and do something about it, make a difference in terms of healthy weight. So obviously when I looked into things, I already knew that childhood obesity and healthy weight is not just a concern limited to my county, but yes, the state, nationally as well as globally. And I'm going to go beyond and say, if it wasn't for COVID-19 that hit us 2 and some years ago, obesity was the true pandemic that we were facing. So obviously COVID-19 actually compounded the whole concern about obesity, not just for children, but also for adults. And that's why I decided to dig deeper into this topic. So just wanted to put some statistics out there, and they're still true. We don't have data for 2022, so this is still true for obesity here. As you can see, according to the CDC, in children and adolescents between 2 to 19 years of age group between 2017 and 2020, about 14.7 million children and adolescents have a diagnosis of childhood obesity. And the prevalence rate is about 19.7%. Now, if you look more into details, you will see that between 2 to 5 years, it's about 12.7%. For ages 6 to 11 years, it's 20.7%. And between 12 to 19 years, it's about 22.2%. What is relevant to our discussion today is, as you can see, any disease affects vulnerable population, minority, and places where you have access issues differently, and we all accept that. And as you can see here, you can see Hispanics, non-Hispanic black children, non-Hispanic white children, and Hispanic Asians have a difference in terms of how obesity affected them. Now, this was not known to me at the time because I started this project about a year and a half ago, but this came in just earlier this year. American Academy of Pediatrics published these guidelines for management of childhood obesity, and what they're saying now is for children ages 12 years and older, we initially, yes, if you needed the medication, we obviously we gave it, but lifestyle modification was the mainstay, and we really promoted that. But now the threshold of starting pharmacotherapy for weight loss in children about 12 years is very limited, and so the expectation is to do it in about 4 to 6 months' time, which wasn't the case earlier. For ages 13 and older with severe obesity, the recommendations are they should have a metabolic and a bariatric surgery evaluation. So this actually helps you get a perspective of why it was important to bring in that awareness and education about healthy lifestyle in children and healthy weight in children and families, because none of us sitting here want our children to go under the knife for weight issues, right? We want to prevent that. If it has to happen, it will happen. And if you need it, it's going to happen. But what I'm trying to make a point is we want our children to understand the importance of healthy lifestyle and embrace it so that we don't get to the stage of this decision making. Okay, so a little bit of statistics more as to discussing how Wisconsin fares nationally. And here I have four graphs for you. This is the number of years, and then you have the percentage in terms of obesity rates. The first graph talks to you about under 2 years of age, and as you can see the line, we are just a little lower than 15%. In age group between 2 to 5 years, as you can see, we are just a little over 15% of obesity. And here, as you can see, between 9 to 12 years of age, we have data right from 2001. So it gives you about 20 some years of data. And as you can see, a progressive increase in the last 12 years. And now our obesity rate for that is again close to about 15%. And what happens if we do not start working on weight management is this. So these are our adult population. Are in Wisconsin, about 35% adults have a diagnosis of obesity. So that is why it's important for us to address obesity early on in life. So what did we do? We decided to work on a resource because we wanted to bring in that awareness and education. So I developed this children's picture book titled Kids, Come On, Let's Get Healthy, a complete kids' guide to a healthy lifestyle. Now this book is widely available to public and it's having a national impact in terms of obesity and is also supported by American Board of Pediatrics in terms of highlighting the resource as such. And what I love about this is a children's picture book, which means there are lots and lots of illustrations. It's not just information. What we have done is we have simplified medical information regarding healthy lifestyle and given it to children in the best possible way, which is kid-friendly and highly interactive. This is right now aimed at children above 5 years of age until 18 years, but the adults who have read this book to their children in the family actually say that this is what they were looking for as a resource. It's everything in one book. And this is not a book only for children who have a diagnosis of childhood obesity, but instead it is for everybody. It is for everybody to know what healthy lifestyle is and what we need to do to embrace it. So to give you a little bit of background, we have information on nutrition, sleep, how much water do you drink, screen time, what kind of activity you should be doing, motivational interviewing, a negative impact on body image, so bullying and goal setting. We also have some fun, interesting recipes that children can try out themselves at home. So a lot of fun things that we have packed into this small resource. And my aim of creating something like this was to have something given to our community members, something that was by the community and for the community. So we made it a community affair because I'll tell you this, in my experience, it has to be a shared accountability. Not one person or one organization or system should be accountable for health. So we got to keep equal accountability on the community and our patients as well, and not only expect us as healthcare professionals to be responsible for their health, right? It makes sense that we share this accountability with the community. So what we did was, obviously I authored the book with information obviously from our town and the experiences I had and what I do in the first year and a half or so. And then we had a child actually was a fifth grader at the time help us with illustrations, and she did a great job. I'm going to have a different slide, next slide, to talk about it. And we also included the other community members to participate, and we got it published within our community. So we did not go elsewhere. And the reason being, we wanted to make this more like a wave that this is our product, this is for our community, and we are going to promote healthy weight. And whatever it takes, it's our accountability. Nobody else is going to come and help us out in this. So here, as you can see, is an example of, so it's one page, this is what we did. This page demonstrates what we offer children instead of a non-nutritious food choice, which is on your left side. We are recommending a relatively healthier and nutritious food choice. So instead of a piece of cake, dessert, you have a fruit. And the aim was to show children that yes, we still will have a similar taste, if not the same, but if you want to eat sweet, you can actually replace it with a nutritious choice. So we did a lot of information giving and teaching and guiding children through this process. So this is the currently sixth grader, but she was in fifth grade when she helped us with the illustrations. And again, our point was to make this a community thing. And she belongs to the Stevens Point School District. Her name is Serene Soman, and she studies in McDill Elementary School. And the whole process to involve children into the making of she wasn't the only person who was part of it. We had interviews with children in the school and talked about what do you expect in this resource. We showed them certain pages, we got feedback, so we made it really a customer friendly, if you can say, because we wanted people to embrace it in the best possible way. So here's WAW in her class, taking her video because she was promoted on their channel, well, not channel, but news for Wisconsin Proud segment. And this again shows how important it is to involve children in their own health and really put that accountability on them. And the best part is she wants to be a physician when she grows up, and I think that's exactly what we want. We want physicians who are so into the community and trying to make a difference in whatever way they can. So again, we always promote newer physicians in that pipeline. So what did we do with this? I'm going to show you a video because obviously a picture speaks 1,000 words, and I wanted you to see what we did. So with the support of as far as Stevens Point Hospital Foundation, we were able to give free 1,000 copies to children. Let me just pause here. Trying to minimize. So while we put up that video, what we did was we gave 1,000 free books to children, and we tried it through different avenues, not just did it in the hospital setting because we wanted to bring it out to the public in different avenues. So this was a farmer's market event, and what we did was we gave the books free to children, and we gave them $5, and we said, go shop for your favorite color, fruit or vegetable, favorite color from the rainbow. And you can just see the beautiful faces, the smiles on children's faces, and families where they saw how excited children were actually to learn and apply this knowledge about healthy lifestyle. Sometimes we just assume things that, hey, I tried saying this to my kids, but they don't listen. But sometimes when they're involved into a community setting, when everybody is doing it, they just learn better. And so we had about 200, well, actually about 150 families and about 300 to 350 children who participated in a short notice of about 48 hours. We did not even have the funding to do this, but we collaborated with multiple community foundations and convinced them how important this was. And when they came in, the board of directors and the community foundation folks, they saw this was so important. Nobody thought that this would be successful. Nobody thought this would make sense. But I think when you look at the age groups, it's not just younger kids, but also teenagers who participated, and families were, see, these are the teenagers I talked about, and they were having so much fun, including adults, and we really made a huge difference while we did this. So we did not stop here. We also went to schools. We went to 9 elementary schools. Apologize for that. So we went to 9 elementary schools and we gave a presentation on Let's Eat a Rainbow. And the idea was to also give them this book through that avenue. And now this book is part of the 3rd and 4th grade science curriculum. And as you can see, the kids were so engaged. We wanted to focus on 3rd and 4th grade because that's when they start learning about nutrition. And so even there, we aligned their learning into this hands-on health education. And like I said, you can see their faces. They're so excited to learn about this and learn about this in terms of as a resource. And we made that point clear that we wanted children to eat at least 5 fruits and vegetables in a day from different colors of the rainbow. So obviously, once we did this, we also wanted to see whether the knowledge they learned were they able to apply. And so we had this where they were able to apply the knowledge and through different games, and it was so important to learn from these different games. We had about 7 or 8 games, and I'm going to just exit so that we can move on to the next. But it was just so nice to see children apply this knowledge. And so moving on, what I really learned was the key to all these challenges that we face when we try to reach the community members is collaboration. That is the key. And so what we did was we made sure that we collaborated with the key stakeholders. This is our mayor, so the guy in red that you saw in the farmers market event, he was personally there to promote this event. We collaborated with the school superintendents and also different members of the foundation. And this is something that I would love for you to take back home as to what could organizations do to support physicians in community. Remember, I don't think that there is lack of talent or lack of intent or lack of passion, but we only have 24 hours in a day as physicians. What we're doing in our day-to-day practice is also noble and is also caring for patients, but it's important for us to note that what we do every day is only 20% of healthcare. What is true healthcare is what happens outside, 80%. That is also something that we need to impact. And so here, I have certain things that you can take up to your leadership, where we have to increase community engagement in terms of all healthcare organizations. We need to have community engagement leads, where we have a specific person who is the point person to learn about these programs so that physicians don't spend too much time in doing that. We need to align our community initiatives according to the Community Health Improvement Plan. Otherwise, really, there's no super benefit about it. Collaboration with community foundations is the key because you want the community to get involved into this, not just financially, but as an accountability. Interactions with community members in project planning, having diversity projects and diversity leads where diversity and inclusion is the key. Another idea is to have productivity protected community engagement where if you are production based, RVU based, if you're going out in the community for such projects, then that should be counted in towards your productivity and you shouldn't lose out on your, well, you gotta get your money and feed your kids, right? So you gotta get that money in as well. Funding preferences according to chip-aligned projects is also something that the foundations can help. And I cannot stress more on physician rewards and recognitions. It is so vital for all of us to feel valued, not just by the community, but our peers and our organization. And it's important for early career physicians to climb up that ladder and promote themselves. And obviously that acts as a booster to do more and more in the community. So active involvement of physicians is extremely needed right now, and media focus. Most of us suffer from imposter syndrome, or we try to just keep things contained within ourselves. But what I want you to do is, if you're doing something, bring it out in public, because we need the public to know the good stuff we are doing, not just within the four walls of the hospital, but outside, because that's where healthcare, most of the healthcare happens. So takeaway point, we need healthcare organizations to back us up as physicians as we try to engage into community, because this is the only way we can have community engaged physicians and this is the only way this is sustainable. Thank you.